Welcome to the Meaningful Happiness Podcast. I'm Dr. Scott Conkright. Every one of us has learned to love before we learned how to think about it. Your body picked up a pattern early, a way of moving towards people or away from them, long before you had words for any of it. I call these patterns the relational animal archetypes. Puppy, cat, sheepdog, hawk, horse, sea turtle, hummingbird, and hedgehog. 8 distinct ways your feeling system learn to connect, protect, and sometimes hide. On this show, I will start focusing on what drives your relationships from underneath the surface. Not just what you do, but what your body does first. If you want to find your own archetype, I built a free assessment at scottconkright.com. 30 questions, a few minutes, and you'll walk away with a language for something you've probably felt your whole life, but never quite named. Let's get into it. Hi, I'm Dr. Scott Conkright. Welcome to the Meaningful Happiness Podcast. Today, I am with Pamela Rosin. Pamela is a licensed marriage and family therapist dedicated to helping people find belonging, grounding, and comfort in their bodies. As a certified Hakomi therapist, she blends Buddhist and somatic psychologies with body-based modalities for deep healing. Her work is uniquely enriched by a diverse background, drawing on years as a professional actor, body worker, and prison Shakespeare teacher. As an educator and adjunct faculty at the California Institute of Integral Studies, she brings warmth, creativity, and a focus on nervous system regulation to her teaching. Pamela has led the Growing Ourselves Whole programs many times, is a published author, and has presented at major conferences like Bioneers and AGPA, the American Group Psychotherapy Association. She is also the originator of Reparentive therapy, which is going to be our focus for today. It is an honor to have her here. Please join me in welcoming Pamela Rosin. Thank you, Pamela. Pamela, walk us through what reparative therapy is at a basic level, what's actually happening in group sessions that's different from individual talk therapy. And in doing so, give us some what's happening theoretically as well as interventionally.
Well, first of all, thank you so much for having me, Scott. It's so great to see you after our time together at AGPA.
Definitely.
Yeah. So reparative therapy was born from my own history and need. I grew up in a family with patterns of borderline personality disorder. So my home was filled with lots of blame and shame and unpredictability. And I created a peer group, and it was revolutionary to be able to sit with other people with similar experience. And so that set me on a path to becoming a therapist, and I created a 10-week group, and this is the group called Growing Ourselves Whole, and I've offered that 13 times. And when I saw the incredible change that was happening in my clients, I sat down with a mentor. And I said, what's working here? Something's working to create change for people with severe developmental trauma and with a history of invalidation. And by mistake, I put together the words reparent and reparative. And when I said the word reparentive, it was this eureka moment.
Hey, there you go. Voila.
Yeah. And so I've developed 10 principles, and those guide my work with clients and my trainings of therapists. And it's a lot about the therapist using our own regulated nervous system to create co-regulation in the clients and in the group, and to be the reparative parent, and to learn to teach the clients to have that loving voice of an inner parent for themselves. So it's not just that I'm reparenting my client, but I'm teaching the client to hold themselves with love.
So is that a lot of modeling, would you say, where they're bringing in, integrating sort of your voice and your way of being in the world as a new, as I call it with my patients, a new board of directors?
Oh,
So,
that's a good way of putting it. Yes, I would say that, yes. And also because I'm doing this work in a group, they're also having this reparative experience of family and chance. This other aspect of reparative therapy is that clients would show up in my office, and on the apparent level, there'd be a desire to heal. There'd be like, yes, I'm here for therapy. But I noticed like that there were like what I sensed was like reins holding them back. And
mm,
those were these internalized contracts with their caretaker, never to threaten the relational bond. So that my work I see of reparative therapy is like, how do we bring these contracts to the conscious level where they can be healed? And so a lot of what I'm doing through the reparative therapy is making it safe enough for them to see what has held them back and what those beliefs are.
that
And
must
so
be
the
pretty
group,
powerful. Yeah.
so
Yeah.
that's like at the core of what I'm doing. And the group experience and the experience of being loved and in the field of love is a chance to surface those core beliefs and have a new experience of self and community and family and new possibilities.
Those unconscious family contracts are so insidious, aren't they? The, where, what
So
you're doing, it sounds like, Pamela, is really, you're breaking a lot of taboos. And I'm sure that that causes a lot of anxiety, I would imagine, for your patients, for your clients. And so I'm wondering if group is one way to dissipate some of that anxiety, or does it increase it? Or is there, I imagine it's a complex web of things. But I'm curious, why
absolutely.
group instead of just individual?
Yes. Okay. Well, so I would say that even just the act of reaching for a group might bring up a sense of, oh, I'm betraying my parent, my
Mm,
caretaker, or my sibling, or my partner, or whatever it is. It's like there's so much shame and secrecy around the connection to your person. So just getting through the door and into the virtual group, it can be a big leap. But once people are in a group, in therapist speak, I talk about there's a different object permanence. And
mm,
what I mean by that is if I'm in a one-on-one therapeutic relationship with somebody and show my care, they can be like, yeah, but I'm paying you to be my therapist.
right,
If
right.
if they're in a group and they see, wow, I'm sitting next to Scott and I'm sitting next to so and so, and I'm in this group, and I see that I'm so sorry that you've lived through this as well, but I feel so much less alone because I'm here with other people who have a shared experience.
Right.
And so this, what I call the object permanence, it's like I internalize that my therapist cares about me in a certain way, but if I'm in a circle of others with a shared experience, I'm going to internalize that differently
Right.
and walk away, and it integrates into my nervous system in a much more lasting way.
Wonderful. You work somatically and relationally. What does somatic mean in practice here for you? Because I know that I'm working right now with my animal archetypes, saying with them that each of us have the 8 different archetypes that there are different ways of moving your body in space related to shame. And so I know,
Yeah.
so you're much more advanced in the somatic area than I am, which I'm happy that I have you in my life to learn from you and everybody else who's listening. I would love to hear how somatic works in your model, so myself and others can learn.
Sure. Well, before I developed reparative therapy, I was working doing touch work and as a massage therapist, body worker for 10 years. And it's kind of even also what led me to the path of becoming a therapist because I would feel things happening in people's bodies. And I knew that it was deeply emotional trauma, not just an injury. And I think that so often we can understand things on a cognitive level, but until it shifts in the body, like the muscles, the tissues is where the trauma lives.
Yep.
And so in some ways, my somatic work is doing work from the inside out, working in the same where I used to use touch to work outside in. In reparative, yeah, go ahead.
I had a question there, if you don't mind, if I digress just a
Mm-hmm.
little bit. The the way I'm hearing it is that the somatic part is that the wounds are actually almost physically in the body or in tightness or in almost located in spots in the body. Like I think when I get a massage, my massage therapist will say like, basically, the other day she says, "It looks like the whole body is a problem," and I said, "Exactly, yeah." It's been a while since I got a massage, but she'll often say, "Hey, I can really feel it in the shoulders here and there's tension." So I'm thinking of it that way. I know that the difference, and I'm curious your take on this, is that the difference with the archetypes that I'm trying to push is that it's in movement, that the archetypes, each of us, a puppy moves differently than a cat versus a hawk who will then fly up on a branch away. So it's somatic in that sense, in that each has a signature sort of way of being in the world protectively. A hedgehog will just disappear. So
I
curious.
love your archetypes for that reason. It's so cool to because also the archetypes spark something in the collective conscious or unconscious that's like, oh, I know something about a hedgehog and I know something about a puppy.
The imagery is really like intuitive, right?
So powerful.
So in terms of the different types of somaticism around, if that's a word, how would you describe the difference in terms of it, where the body comes in?
Well, where the body comes in, there's so much I could say. So rather than working with archetypes, I'm working with how is the experience of growing up walking on eggshells, how does that result in someone's body? And what needs to be created in order for there to be safety to start unwinding some of these patterns? And so when I'm working in a group, each of my 10 sessions of my therapy group has a theme. And on the week that we're working on emotional volatility, I think of what is the antidote to that? And so I offer a somatic experiential that's about grounding, or I offer containment, or something that helps us feel our edges. And so I'm weaving together what is the activation that's happening in the body, and how can we what is the antidote to start to feel more present? And so that my clients then have a whole toolkit of resources, because my hope is that they go into their life and they're able to say, oh, I notice when I'm starting to go into hyperarousal, and I can pull myself back, and I can find maybe my body has never been safe because my home was really unpredictable. But the path that I'm on I'm speaking as a client, the path that I'm on starts to feel a bit more safe in the body because of this therapy, because of the resources and the language that I'm starting to speak. It may be a language I've never spoken before.
Yep. That sounds very empowering. It sounds like very giving lots of agency, or increasing agency in terms of what's happening in one's inner world.
Absolutely. Yes.
I try to stay off Instagram as much as I can, but given somebody who's posting, I'm always having to check stuff. And you may have seen it. It's a real popular one, watching these little puppies or dogs versus cats going through these obstacles. And the puppies knock everything down. And the kittens just walk through everything without touching anything. That's the sort of movement that I use in my groups, talking, especially my men's groups, talking about the difference between a puppy and a cat versus a sheepdog and so forth, is that, if you're a puppy, you tend to have to do a lot of cleanup work, because you tend to come on a little stronger, and you're enthusiastic, and versus a cat who's going to be more cautious and so forth. And talking about just in generalities, of course, but it's those sort of movements that cause problems in intimate relationships, because the cat, if the puppy's married to a cat, the cat's going, I've already told you, I'm up on the top of the fridge for a reason, just to get away from you, and I already told you that. So just chill.
He's like, what?
He's like, what did I do wrong? And don't you want to play? It's like playtime. I've been waiting for 15 seconds now,
So there's no wonder that they're big misses, because they're
big misses.
Different creatures.
And that is a different type of issue than of course, the trauma that you're dealing with people that have grown up where it really made their worlds unpredictable, and it's hard to know what scripts to use in relationships, especially when you're feeling really churned up inside. So I'm wondering if you can speak to that, how trauma affects that in in relationships.
Yeah. I mean, we're talking about, okay, at the fundamental level that I had to attach to and defend against someone who was unsafe,
Yep.
someone who I was dependent on for my nurturance and view of the world and everything. And so these two things are very confusing neurologically and leave an imprint at a very core level. So
Right.
also their messaging around boundaries, like that I can't have myself and a connection with you. I either need to steamroll, be obliterated, no sense of self, no wants, no needs, no boundaries if I want to be in connection. It's at the core imprint.
That is
And
a horrible bind, isn't it?
it's
Yeah.
And because it is imprinted there at what I talk about as the core fractal, it's going to project like a hologram into every interaction in my life. It's going to be very confusing. And my somatic shape as a result is I'm going to be twisted in knots. I'm going to try extra hard. My nervous system is going to not be able to rest or trust. I'm going to be hypervigilant about what's going on around me. All of that. Which of the archetypes does that best match of yours?
I think the butterfly and the hedgehog can be the ones. The hedgehog basically says, I want, but I'm barely going to be in touch with it. And so I'm going to basically just stay under the radar relationally. And if they're lucky, when I use the archetypes in this way, it sounds kind of funny. I met a hedgehog the other day, a person who certainly has those characteristics.
Uh-huh.
And she was very, she was with her husband who I knew, and I'd not met her before. And she was very quiet and very self-contained. And we were at a public event, and my friend basically said, just leave her be. She's good. Don't even try to sit next to her. She's hey, that's helpful for me to know. Having lots of puppy energy, I'll see her by herself and want to like sit next to her and like blah 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 blah.
Do what you can to tease her out.
Which is
Of
not what she
course.
wants. The the hummingbird is what you're talking about with families really inconsistent and traumatic parenting, where you don't have a script or you have multiple scripts, and
Right.
you really desire a lot, but then desiring is very dangerous. And then if you let your guard down, then you get wounded. There's many things that are happening. One is that your perceptual skills relationally are often not as fine-tuned as they need to be.
Right.
Because you're perceiving it through a particular filter, which sadly we too often recreate the trauma that we're trying to avoid.
Right.
And so with that said, it sounds like you're familiar with what I'm talking about there. So maybe you want to speak to that a little bit, because I wonder if you
Yes.
see that a lot.
Yes. Well, I have the when we spoke earlier, I mentioned that I have this image of an anglerfish, like that. I
Yes,
think of
that's a
that
great
deep
example.
sea anglerfish, which has this incredible adaptation of this luminescent lure that in nature it serves to attract its prey in close to it. But what's fascinating, it's like it's attached to the anglerfish.
Right.
And I think of what I've seen in myself is that the BPD wounding that's been patterned into me precedes me, and I come into situations and my eagerness or hunger or disappointment at ways I haven't been nourished, like vibrationally precedes me coming into the situation. And it actually serves to reinforce me not getting what I need because I scare people away.
Yeah.
And it's incredibly painful. So I don't know if that relates
it
to
does.
what you just asked.
Well, it's interesting because with each of the archetypes, there's a different type of wounding. So the most prominent ones, there's some variations of each one in all of us, but the fear of, am I too much versus am I not enough? So, or am I tolerable? Am I desired? All those sort of questions. What is your focal shame point? And I think with what you're talking about is with the more, is it fair to say, dissociative sort of dissociative sort of character characterological frameworks, profiles, it flips. So what happens is that the person that you're with doesn't know what they're getting all the time, or you don't even know what you're going to show up with half of the time in early stages of treatment. Later on, I think that's part of the therapy, is helping people identify what they're actually feeling, then display it correctly.
Right. I just thought of another animal. It's like a chameleon.
Yeah.
It's like they're expert at, don't mind me, how are you doing? So it's fascinating when I have a therapy group filled with people with this history, because everyone is so good at being like, are your needs met? What about yours?
That's my sheepdog. And I think the chameleon could have been the perfect one for that as well. So in my model, I contrast spine versus heart.
Right.
I make a really important point of saying that they both are necessary, and you have to have an equal strength with both. You need to be able to open your heart up for other people and be vulnerable. But there's a certain vulnerability by displaying spine as well. People don't always want spine. They want you to cave. If you grew up in a family with parents, a mother, father, or whoever, saying that you're going to bend to my will, whether they say it directly or the message is one way or the other, you're supposed to take care of me. You, the child, is supposed to take care of me and my emotional needs. You give up your spine,
Right.
So in the cost of having a spine, the cost of standing up for yourself and having boundaries and holding your ground is too high.
Right.
So it can feel like another betrayal or taboo as an adult to start doing that in an intimate relationship, because you feel like the person is going to shame me, or I'm going to lose them if I maintain my boundaries. So the heart and spine need to be working together. So each of the archetypes is missing in some ways around that. So that each person has work to do. I mean, the butterfly goes back and forth. Too much spine, then no spine. The sheepdog is like, I'm wondering if it's like your chameleon. The way I see the sheepdog is that they don't have a lot of spine for themselves. They're chameleon-like in that sense, except they will be there for everybody else. They will show up and take care of everybody at their own expense.
Right.
Does that fit with how you're envisioning?
I absolutely see that in so many people through my practice, for sure. And I'm offering a workshop that I feel like is like the creme de la creme of reparative therapy, and it's called The Daughter Who Couldn't Rest, Rewriting the Legacy of Never Enough. And it's for people who don't identify as daughters necessarily, and it's just because the title was so compelling. But it's really, what I realized is that there is this sheepdog energy of it's not okay to rest. It's actually urgent that I be on all the time. And I can feel in myself, it comes from this sense of like, I was given such intense messaging that I'm flawed, that there is no time to rest. I have to make myself better and the world better, and it all rests on me. And I'm propelled by that energy constantly. On the other end of the spectrum, I see clients who are so low in the hypoarousal that they can't get off the couch, and that the foot is on the accelerator and the brake at the same time. But like there's a very strong, like, having been so overridden by the parent over, not accepting no for an answer, and subverting the child's needs in favor and totally eclipsing the child, so that as an adult they're still stuck in the like, you're not going to make me, that kind of like resigned fatigue, grief, anger, all mixed into one, and it just looks like depression.
And because I think it really is depression, because if you put the puppy on one side, which is full of interest and excitement, for everything, and for some, I mean, I got lucky in my family, despite other things that could have been much better. What I did get is that it was a family that cherished learning and cherished new opportunities and getting excited about things and so forth. And I found that as a child, I can engage others in that way, and we could have shared enjoyment, shared interest and excitement, and that's up energy. So I could disguise my depression with the positive affects, with the positive core feelings. If you don't have that, I think by definition, if you don't have the core affects of interest, excitement, which is on a continuum there, and enjoyment, joy, you got depression and anxiety. So you're basically giving up on getting the good stuff and trying to minimize the loss of the bad stuff, or minimize the damage done by the bad stuff. So that's where you get the hedgehog, you get the horse, and some of the others.
Interestingly,
sea
I was
turtle is,
just
I
going
think,
to.
there's a healthy version of the sea turtle, like an acquired one. And there's the sea turtle that's just the one that's just avoiding. But go ahead, Pamela.
Well, I was going to say that different from you have like a real like model for analyzing and giving people an archetype. In my work, I have these 9 buckets of healing. I have 10 principles that guide the therapists. And then I have my 9 buckets of healing that really speak to, there are, as I see it, like, I'll just start with like the grief bucket. Like we just have to keep pouring water in until we're done. And sometimes that bucket is bottomless. The grief can just be bottomless. But there's certain steps along the path of the healing, and I just see them as buckets. We're going to have to keep it, because the history of this kind of wounding is filled with so much gaslighting and so much being told it was day when we knew it was night. We have to go back and see things clearly. So the seeing is one of my buckets. The grief is another bucket. So I'm almost like in a different dimension looking at like, okay, what are the elements that it takes to heal, more than what is the archetype that applies to this population.
I think you're doing really valuable work, and I need to get more acquainted with it. And so I'm glad that we're doing this, and I'm getting a little bit more acquainted with it. The thing that I think is the difference is that I think in the archetypes, as I'm using them in my group, is that each person in the group now knows their archetype, and so thus has different skills. And so when each person's read up on much of the stuff that I've written, that is. So, for instance, I don't have a lot of hawk in me. My approach to dealing with things is not to like fly up on a tall branch, a high branch, and like get my claws ready and looking down with like one eye, assessing. A useful skill to have, So the group members will say, hey, I could use some of John's hawk energy right now, and then help each other learn those skills, skill building, by identifying what's missing. What were you told in your family that you can't do? Well, in my family, you did not confront your parents. You did not get angry. We had a very Swiss, very narrow bandwidth of affect. And so you didn't raise your voice. You didn't scream and shout. So there's none of that. It almost felt kind of deadly at times that there was anybody alive here.
And so you became a therapist.
Exactly. we both became therapists for similar
Very
but different reasons.
Right.
So but yours sounds like there's real concrete movement towards a certain type of healing, which I like hearing. Like there's progressions.
And it's funny that you mentioned the hawk, because when I took the quiz and I feel like I could take your quiz and think of myself in different contexts and get different results. But when I really took the quiz and I thought, how am I being in my current intimate relationship? I came out a hawk.
Oh, is that right?
And it's so fascinating. I think it's from all the ways that I was wounded with my mother's grandiosity and meanness. And when I'm scared of intimacy, I go to these places that are very protected.
Well, that's an interesting thing you just brought up, because I want to tell people that when you can take the assessment as many times as you want, but each time that you do, you might want to think of a different person in mind. Family member versus an intimate partner versus somebody else, friend.
I mean, I'd like to take the quiz again as in my lovely therapist role, because I think I'm nicer there.
Well, so one of the things I'm trying to fix on the website right now is the readout, which is when you first get it right now, if anybody takes it in the next few days, and if you do take it in the next few days, you get the readout on the screen of the percentages of each one. So I wanted to remind everybody that we have all of them in us. We all have access to it. I'm not going to access my butterfly archetype very often, but I have when I was going through a divorce, when I was going through some really traumatic other events. I was chaotic inside. I was all over the place. That's not my style in general. Hawk is like one of the bottom ones for me, but it doesn't mean I don't have it. But you're right. If I were to take it with certain people in mind, my hawk would climb up there a bit, and I think that's a normal thing. And I want to stress to people that that's healthy. It's saying that you know how to protect yourself, like for whatever reasons, that's something to pay attention to. Oh, I do feel hawkish. I feel like I need to keep an eye and analyze this person because they could hurt me whether they intend to or not.
Very
so the question
wise.
is not to say there's something wrong with them. There could be. I don't know this person, but it's something questions to ask.
Something that I see in common between my work of reparative therapy and your work of your animal archetypes is the non-pathologizing nature.
Thank you. Yes.
Saying like we've developed these things for good strategic reasons, and bringing it to life in the form of an animal is so like relatable and kind, and even if there's armoring in it or there's over eagerness, there's something very sweet about delivering it via an archetype. And similarly, I think that the field of psychotherapy and the Institute of the Mental Health Industrial Complex can cause so much harm in the ways that we diagnose and pigeonhole people, and it can be so impersonal. And so I'm really committed to looking at the pain behind the trauma of this intergenerational phenomenon and bringing a lot of love and compassion to my work and to clients. Yeah.
And I'm hearing that, and I love it. And I think that I really appreciate, as we sort of wrap things up here, that you brought that up at this time, because I feel like depathologizing is so important, because the last thing we want to do in our field is to bring more shame to the reparation of shame.
Amen. Right.
So let's pay attention to how shame works. And that's really what I'm trying to do overall, is really the drop, as I call it, the shame response, is built in. It's basically the brake that we get like putting on the brake in relationships. It says, stop that. I don't like that. Or something's gotten in the way of feeling good. So there's a biological aspect to it, the affect of the core feeling of shame. And then there's the emotional shame, which is the history that you have that gets reactivated anytime the affect of shame gets set off. And so it becomes a cascade. And so I hear what you're doing, like I'm doing, is helping people catch that cascade or that cycle so they can step outside of it, not always in their head cognitively, but in a body-mind connection that says, this is what my body's giving me data now. My mind's going to pay attention to it. I'm going to make some other decisions so that my body can calm down and I can be in this relationship with myself and others in a different way.
So true. And I feel like we are colleagues and allies in the battle against shame. I mean, it is so pervasive, and I don't think a lot of therapists or modalities speak about it as much as it deserves. And I'm so glad that you use it as an orienting principle. And I absolutely see that so much of the trauma I'm working with is about internalized shame.
Yeah. Appreciate it. Thank you so much, Pamela. This has been great.
Would you
let people know how to reach you? I'm obviously going to put it up online and all that, but you might as well say it with this workshop coming up. That way, if they hear it, they can go to your website, which is...
Totally. Okay. So my website is reparentivetherapy.com. They'll find I have this workshop called The Daughter Who Couldn't Rest, my Growing Ourselves Whole group, and my training for therapists.
Fantastic.
There.
Fantastic. I look forward to hearing how that goes. And we'll be in touch. Thank you, everybody. And thank you, Pamela. Until next time.
Thank you so much.
Bye now. That's it for today's episode of Meaningful Happiness. If any of this landed for you, the archetypes go a lot deeper than we can cover in one conversation. I've written an ebook series called A View from Within, one volume for each archetype, walking through patterns in detail. You can find these, along with the free assessment, at scottconkright.com. That's SCOTTCONKRIGHT.com. Thanks for spending this time with me. Take care of that heart of yours, and I'll see you next time.